Hello?
Just be myself in front of the cameras and the lights. Okay. No, I can't do this.
Yeah.
Probably listening and pausing and waiting. Work ethic, I think, is a big one for me.
Caring, being genuine.
Values that are important to me are honesty, compassion and loyalty.
The values we have at LIFT guide everything we do as a team.
So there's a rule that's called the inverse care law, and that's that the people who really need the help the most often have the most trouble accessing it.
Accessibility is about delivering the services that people need at the time they need them.
There's no barriers to treatment here, everyone can access it.
I think of just being able to get what you need without too many obstacles.
What I'm listening to from the patients is that undergoing care is so time consuming and not knowing or what's available for them out there. So accessibility is for them understanding what options they've got and how to improve their care and having access to it all in one place.
I think caring is about saying, well, look, I can shoulder some of this for now and it's not unreasonable for me to do that.
I think of care as being about attending to the whole person from head to toe.
Creating a safe space and a community sort of environment.
We are looking after the person, not just the cancer.
Empowerment in this setting, I think, is really important. It's one of the things that the patients have talked about a lot, is that they're taking control of something with their cancer.
Empowerment is about providing people with information and education to allow them to make decisions and take control over a situation.
It's helping them to see themselves at their best and to act in line with that.
I feel like empowerment speaks to translating that language for people.
And I think it's important that they have clear, concise education and information so that they can make their own decisions about their treatment going forward.
I think people need to control their own lives and be able to have choice.
Providing a scaffold around them for them to work out for themselves, and that gives a sense of achievement, competence, confidence and hope, really.
We've got our 3 values, but there are so many more that we see lived at LIFT every single day. When I look at my team, there's a clear commonality. They have a shared purpose, and I can see that they feel like they have got the ability to make things happen.
I think the passion of everyone that I've come to work with at LIFT has been the really most impressive thing, and one of the things that drew me into wanting to work here more.
Compassion is very important.
I'd say it's fun.
We have a lot of fun because people feel productive and active in their care.
Enjoyment. I think, cancer is tough. I think it really can rob you of moments of joy, but you can have a laugh and a joke and people just treat you like a normal person, and I think that's beautiful.
It's here inherently in everything we do, but it's not written on the board, and it's hope.